Hi, my name is Arnie Advincula, and I'm here at Florida Hospital Celebration Health. Today I'm going to demonstrate the use of the new advincula arch in conjunction with the coefficient colpotomizer system for use in a total laparoscopic hysterectomy. I'm going to take a sterile open-sided bivalve speculum. I'm going to place that in the vagina. And what I'm going to do in this case is visualize the cervix. Now there are two important steps that have to happen before you utilize the advincula arch system in conjunction with the coefficient colpotomizer system. The first is you have to sound the uterus to get the adequate length so that you can determine what size roomy tip to utilize on the end of this uterine manipulator. So I'm going to go ahead and grab the anterior lip of the cervix with a single tooth tenaculum. I'm going to take the uterine sound and pull that forward. And it looks like here we're sounding to about 8 to 9 centimeters. So I'm going to need an 8 centimeter tip. Now, aside from utilizing visual inspection, the other thing you can do is incorporate a cervical sizer into determining the appropriate colpotomizer cup. As you can see here, this sizer is labeled so that we can determine whether or not we need a 2.5, 3, 3.5, or 4.0 size co-colpotomy cup. And it looks like I'm going to need about a 3.5 centimeter co-colpotomizer cup. So we'll go ahead and first of all open the roomy tip. And you can see we have a size 8 here. Going to go ahead and untangle this. One of the things that you're going to notice is really how easy it is to place the tip on the advincula arch. Once you secure the tip on there, one of the first things you need to do is utilize the catheter management system. Now, as you can see, there are two catheters. One is for chromoperturbation, and the other is to inflate the balloon at the tip. Now, since this is a total laparoscopic hysterectomy, we're going to go ahead and just demonstrate how you can easily remove the chromoperturbation tubing. So I'm just going to again pull this, and you can see that it easily comes off right at the front end of the uterine manipulator tip. We're going to set that off to the side. And I'm going to go ahead and use the catheter management system here and very securely place the tubing for the balloon inside those grooves, and I think you can see that right here. There are grooves along the side of the instrument. And make sure you secure it nicely in the back. Once that's done, this is the coefficient colpotomizer system that we utilize with the advincula arch. And you can see here, this is a 3.5 co-cup, has a built-in pneumo-occluder balloon, and so we're going to initially place this on here. A little bit snug, but once you get it through, you're going to rotate it, and we're going to lock it into position here. Right? So that's locked, and that's going to be ready to be placed. But before I can do that, what I need to do is I need to dilate the cervix. And typically, I'll dilate the cervix to about 21 to 23 French to facilitate placement of this uterine manipulator tip without difficulty. So I'm going to go ahead and start the dilation process. And I'm using Pratt dilators in this case. I tend to favor those because of their tapered design. They tend to go into the cervix fairly easily. Now I'm going to take this advincula arch in conjunction with the coefficient system, and we're going to go ahead and place it now. And you can see this is where this is a game changer in the fact that this is backloadable. So now I can have complete visualization of the cervix as I place the tip, and then we're going to advance the colpotomy system afterwards. So again, you can see where that changes a little bit here. We're going to go ahead again. I've got the cervix secured with a single tooth tenaculum. I've got the open-sided bivalve speculum in. I'm going to carefully place this into the uterus. Once I do so, I'm going to go ahead and obtain some fluid here, if we can have some fluid. And so we're going to go ahead and it says balloon tip. You want to pay attention to the wording. Place about 5 cc's in there. That easily goes in. Lock the tip into place. At this point now, I'm going to go ahead and take off the single tooth tenaculum, as well as the open-sided bivalve speculum. And this is where it becomes very easy now to place the copotomizer, because we're going to go ahead and slowly advance this. And you want to be careful as you advance the copotomizer ring into the vagina to not catch the labia. So I'm going to go ahead and just get this started here. You want to be able to pass the 3.5 cup around the labia. Keep advancing it. And you can see there's a thumb guide here that you can utilize at the back end of the coefficient system that helps you advance that until you hear a click. You're going to hear or even feel a click as the coefficient copotomizer system locks onto the advincula arch. And you can see here that I'm making sure again that I don't have any labia or vagina caught around the copotomizer ring. I'm palpating with my finger distally to make sure that it's nice and snug around the cervix up into the fornices, and that it's also not the incorrect size. So I'm making sure we have the correct size copotomizer cup, and it is in this case. But you can see how very quickly we've now secured this entire system, and we're ready to start the total laparoscopic hysterectomy. Again, you can see that we have the balloon tip here, and it's secured. Here we have the pneumo-occluder balloon. We have not inflated that yet. I typically inflate this pneumo-occluder balloon at the time I'm ready to make my copotomy. And so you can see that one of the advantages here is the ease of use and the intuitive nature with which your assistant will be able to both antiflex as well as retroflex the uterus, as well as drive the uterus to the patient's right and the patient's left side. It's going to be secure. It's going to allow you to be able to get the copotomy cup up against the fornices. And it's also going to be able to allow you to have adequate pressure, which is critical during various aspects of a total laparoscopic hysterectomy.